Hello, good evening and welcome to my YouTube channel. This is part 2 of how to survive as a house officer or as a foreign trained medical doctor about beginning his house job in Ghana. And once again, I'm in the consulting room. It's raining quite heavily. It just actually started. Patients, I'm done with the patient. I just thought of sharing my thoughts on how to survive house job in Ghana. Once again, I'll urge you to like the video as it will help me grow and as it will help the video to pull more views. The YouTube algorithm will be able to recommend it more to new viewers. Also do subscribe, because when you do, you'll be the first to see any video I drop. So yes, let's get straight into the topic. So the last time I talked about you doing your physical examination, and then yes, the peculiarities as when it comes to the Ghanaian settings, and I gave an example. So the second thing you need to know as a foreign trade when you are starting or you are practicing in Ghana as a house officer would be the system in general. You might have been used to a system where everything is in place, everything is in check, things are flowing. You request for a lab and it's done. There are a lot of mosquitoes here. You request for something and it's done, right? But here in Ghana, things don't flow that much. There's so much frustration in the system. You request for a lab, it takes hours and hours for it to be done. Financial difficulty and the lack of or the unavailability of basic things in the hospitals are something or some of the things we have to be wary of. So what I would advise is that you just try and just don't keep it at heart. Initially when I started, I was like doing all I could, going like just struggling and then always complaining, but I got to realize that that's the norm here, right? Because I trained in a country where health care is free. People come, you request for labs and it's done without anything or without them paying money or having to pay money. And you get the results almost instantly, but here it wasn't so. So it was a bit of a struggle for me. But I got to realize that it's the system, right? So what I would advise is just do your part. Don't what should I say? Do what you are supposed to do and do it to the best of your knowledge, and you would be fine. Because we doctors in Ghana, there's no health insurance coverage for us except the general national health insurance scheme for everybody. If you kill yourself in doing something and you are overworked, overstressed, and it happens that something, you fall sick, no one cares, man. No one cares. You'll be replaced in just the next day, okay? So I've learned that just do my best to the best I can, and then those that I can't, I don't worry much because it's the system, right? So you just keep your head down, you work to your best and don't force yourself. You are easily replaceable, okay? Keep that in mind. And the other thing I would want to emphasize more is when it comes to patient relationship, right? Patient relationships, and you have to create a good rapport between your patients and their relatives, right? because in Ghana everything is, or even the whole world is based on recommendation. So maybe if you are good to a particular client, they might recommend you to other clients. That is when you become an MO, right? Which is opening so much doors for you. Okay. So in this part 2 of the video, basically just work to your best. Don't stress yourself, guy. You just don't stress yourself. Just do what you have to do and you'll be fine. Okay. So do like the video and share. Help me grow the channel. Okay. Help me grow the channel. Okay. Thank you for watching. Stay tuned for part 3.